Welcome back to Virginia This Morning. This Partners in Healthcare segment is sponsored by Senior Solutions of Richmond. Caring people, caring for you.
Often the idea of moving is what keeps seniors in place until a move is really no longer just an option. But the process can be easier. Susan Campbell with More Than Moving joins us this morning. Thanks for coming in, Susan.
You're welcome. Thank you.
We were talking a little bit before we came on, and it really is a difficult time for seniors and for families.
It is. I started my business about 11 years ago when I had to move my dad out of the house that he had been in for over 40 years. And I found in the process that I was not able to give him the attention that he needed because I was so involved in the process of moving. And as a result of that, I realized other people needed help, and that meant that I could come in and work with the family and with the adult children, helping them in the process of moving, which allowed the adult children to pay more attention to their parents and the important things that go along with moving, the retirement community, the attorney, the doctor, things like that.
There are a lot of parties involved, and you guys call it move management.
Move management, yes. I jokingly say that our clients sometimes haven't moved for 20, 30, even 40 or 50 years. We move every week.
Right.
So we know the process of moving. We know the different components. We remember the details that they may not remember.
Why is it important to have this conversation early and kind of get the ball rolling and recognize it can be a little easier?
Well, moving, it's difficult at any age. I mean, even when I was 20, I didn't like moving. But sometimes seniors will put off the idea of a move until their health creates the move, forces the move to happen. And when they do that, their options are limited. It limits their options. They don't get to make the choices that they might want to make as to where they move, how they move. So if the conversation starts earlier, they have a lot more input into it, more options in the move process. And
definitely they get to feel as though they're more of a part of it, more integrated.
That's true. Most of my clients are the senior themselves. I'd say 70-75% of my clients are the seniors, and then sometimes the adult children. But if the senior gets involved in the process early, makes their plans early, then they get to make the decisions rather than having someone make decisions for them.
And More Than Moving is involved with a great network of folks, Partners in Healthcare, yes, and a lot of resources there.
Yes, Partners in Healthcare is wonderful. It's an exceptional organization that gives people a great way to look at the different services available to them and do some research all in one place.
And really find that interconnectivity. Mm-hmm. Now, when folks come to you and they go through this experience, what do they come out at the end thinking?
I've had people tell me that, they always say we couldn't have done it without you. I had one client who told me her friends came to visit her 2 days after she moved, and it looked like she had lived there for 20 mm-hmm. years. So our goal is to make the process as easy, as simple as possible. And we come in, we help with sorting, packing, moving, unpacking. We put everything away. We hang pictures. We make beds. My company also does estate sales. We do clear outs. And we have a consignment store. So our goal is to be a one source, one solution process for moving.
That's fantastic. In 50, 40, or 30 years, you've collected quite a few tidbits. So
people are always surprised by how much they have in their homes.
Definitely. Well, thanks so much, Susan.
Thank you.
Appreciate it. Moving can be challenging at any stage in life, and these guys specialize with seniors and their families. Connect with More Than Moving by calling 232-6480 or visit online morethanmoving.com.